The bright side of addiction is recovery, long-term recovery. The joy of recovery far outweighs the suffering from addiction. Keep that in mind. Hi, everyone. I am Neil Scott, and if you're new to our podcast, we welcome you. If you have been here before, by golly, welcome back. And if you are in recovery, know or love someone who is, or you simply want to know a little bit more about the recovery process, or maybe you're a bit concerned about someone you know or love who is harmfully using alcohol or any other drug, this is the podcast for you, as we carry the message of hope and the promise of recovery. And a reminder, you can find all of our podcasts at recoverycoasttocoast.org. Recent episodes have featured interviews with Sir Anthony Hopkins, singer-songwriter Bonnie Raitt, authors J.A. Jance and Anne Lamott, as well as Tom Farley, the brother of the late comedy legend Chris Farley, and many other prominent people in long-term recovery, plus conversations with everyday people in long-term recovery, sharing their story, their insight, their path. Now, in this edition of Recovery Coast to Coast, I will share a conversation I had with a man who is not only in long-term recovery, but who is one of the key voices in Washington, D.C., fighting for the rights of the treatment community and the recovery community as well. His name is Mark Dunn. He has quite a story to tell. Here's a quick clip from today's program.
I was in such denial. And so, I minimized my use when they did the interviews and really didn't pay much attention. Actually went to a couple of the sessions after I'd had a few drinks. Outpatient didn't really work for me. I was late stage and needed residential care. I bet you over half the members of Congress have somebody in their family who's been affected by this disease.
And later on in the podcast, on The Last Word, we will hear from William White, an alcoholism historian. I think you'll be impressed with what he has to say. Our website is Recovery Coast to Coast, and if you would like to help us out financially, or know of a foundation or a corporation that might be interested in underwriting part of our program, we would be ever so grateful. A reminder that our email address is recoverycoasttocoast, one word, at comcast.net. We'd love to hear from you. And by the way, a good friend of Recovery Coast to Coast, Nima Sarikhani, is a world-class photographer. And he has an amazing photo, which is up for Photo of the Year. I'm going to tell you more about that at the end of the podcast. Recovery Coast to Coast is supported by Sundown M Ranch, one of America's oldest, least expensive, and most successful treatment programs. They're listed in Newsweek magazine's recent list of America's top treatment providers. Now, I've been in the field of addiction and recovery for, over 50 years. And one of the phrases I've heard more times than I can count is, I'll do something about my drinking, or I'll consider going into treatment after the holidays. Well, to those of you who have said that, or if you know someone who did say that, I say welcome to after the holidays. Another phrase I hear thousands of times is, thank God I went to treatment. It was the best thing that ever happened to me. It gave me back my family, my job, and my community. The hardest thing about treatment is picking up the phone and making the first call, or reaching out to a loved one to say, okay, I am ready. Now, treatment at Sundown M Ranch is about a month or so, depending on how serious your addiction is. And when you leave treatment, that is when the real work continues. No one gets well from addictive disease in 30 days. You were certainly using or drinking alcoholically for a lot longer than 30 days. What Sundown does, and they've been doing it successfully for nearly 60 years, is arrest the disease and provide the tools needed to manage your recovery. Is it easy? Hell no. Is it worthwhile? Absolutely. Just as a diabetic or a heart patient leaves the hospital after treatment, they are given instructions on how to live a healthy life and avoid another heart attack or another diabetic emergency. Well, the staff at Sundown are the absolute best. They're well trained, they're kind, compassionate, and passionate about what they do. The staff motto is, "The patient is the reason we are here." Sundown is a not-for-profit center with a bottom line that is not financial but is recovery-based. And because they're a nonprofit, their rates are among the lowest in the country. Sundown Branch is located in Washington State, not far from Seattle, and if you go to their website, sundown.org, you can get a lot more information, as well as see photos of their amazing facility. It's where recovery begins, sundown.org. Well, it's time for coffee and conversation. I'm excited to share my conversation with my friend Mark Dunn. Mark is the Director of Public Policy in Washington, D.C. for NAATP. That's the National Association of Addiction Treatment Providers. As policy representative, Mark represents NAATP on Capitol Hill, at the various federal agencies, and with coalition partners. He advises NAATP and the board on a broad range of public policy issues important to NAATP members. Mark is a partner in Veritas Advisors. That's a public affairs firm with, over 150 years of combined federal government affairs experience. And yes, Mark is in long-term recovery. Here's my conversation with Mark Dunn. Welcome back once again, Recovery Coast to Coast, on the road in Denver, Colorado for the 45th Annual NAATP Conference. NAATP is the National Association of Addiction Treatment Providers. You know, a lot of people ask, how do you find a good treatment program? Well, there's a number of criteria that I like to talk about on the radio show, including longevity in terms of quality of care. One of the things that I suggest strongly is that find out if they are members of NAATP. Because by being a member of NAATP, for the ethical standards alone, there's a lot of bad players in this field, but there's a lot of good treatment as well. But find out if they're members of NAATP, and if they're not, find out why not, because it's an outstanding organization. And I've had the pleasure of being here probably 10 or 15 years doing Recovery Coast to Coast. And joining us in this segment is Mark Dunn. Mark is the Director of Public Policy for NAATP in Washington, D.C., and we're going to talk a lot about that. But I want to begin, Mark, by asking you to take me back to maybe 36 years ago, and tell me perhaps what happened this week 36 years ago?
Well, 36 years ago, after several encounters with the law, I had some visitors and some family and friends who said, after 6 DUIs, maybe it's time to...
How many DUIs?
Only 6.
Only 6.
Yeah. So they thought maybe it was time that I got some help. And so I fortunately went to a treatment program. It was a 28-day...
Did you go in kicking and screaming?
Well, at that point, it was time. It was really the only good choice.
Had you sought any type of treatment before? Did you try to stop drinking?
Never tried to stop. I had gone to a couple of outpatient programs, forced to do it because of the DUIs.
Yeah. Did any bells go off during that time?
No, I was in such denial. And so, I minimized my use when they did the interviews and really didn't pay much attention. Actually went to a couple of the sessions after I'd had a few drinks. Outpatient didn't really work for me. I was late stage and needed residential care.
Well, you were drinking like a fifth a day?
Yeah.
Wow.
Yeah.
I mean, that's expensive, number one, and what it did to your body, I can't even imagine.
Yeah.
What kind of shape were you in when you were into treatment?
Actually, since I was a pretty young man at the time, it hadn't had the impact that it would have had if I'd continued.
Yeah.
They did the medical exam. They did say that my liver was a little enlarged.
A little?
Yeah. It definitely took its toll.
What was the first week of treatment like for you?
It was scary. I had no idea what was going to happen. Actually entered treatment on my birthday, my real birthday.
Wow. Happy birthday, Mark.
Yeah.
What did you get for your birthday? Well, let me tell you what I got.
A trip to a treatment center.
What treatment center was it?
It was a care unit in
Oh, my God. I remember.
Yeah.
Kentucky Fried Treatment. There was one on every corner. That was an interesting business model. For people who don't remember, CompCare would go into hospitals that had low census. They would basically lease out a wing, hang up a shingle, buy services from the hospital, and attract people without having to put up brick and mortar.
Yep, that's exactly what it was. I think it was about 20 beds. We had one floor in the hospital.
Yep.
Fortunately for me, they had a really top quality staff.
Yeah.
And counselors.
And
I'm still in touch with some today.
Wow. And again, that's what I said about finding a good treatment program. It's not about the brick and mortar. It's not about the swimming pools. It's not about the amenities. It's not about the silk sheets. It's,
Exactly.
It's about the staff.
Yeah, exactly right.
That is where the miracles happen, honest to God. And you are a miracle. 36 years, my goodness. So you went through the 28-day program. When you left there, what was the first 6 months like?
First of all, about halfway through the 28-day program, I started enjoying myself because for the first time, I kind of knew what was wrong.
Yeah.
So about halfway through treatment, I found myself really enjoying it. As a matter of fact, one of the counselors came up to me and said, "Mark, are you really having as much fun as it looks like? Because, this is not summer camp." And so I was fortunately really plugged into some friends, and they told me what I needed to do was 90 meetings in 90 days, and I did that. And that really cemented what I had discovered in treatment and really set me on a path for recovery for 36 years.
Wow. So fast forward, you've been in the professional field of addiction how long?
Well, I was asked by some of these same friends who were plugged into NAATP to help the association because they were starting to get back into public policy and they didn't really have anybody doing that. So they asked me if I would step in and help, and as kind of a service thing, I was happy to do that.
You had done government relations?
Oh yeah, 5 years into my recovery, I was hired by one of the largest privately held companies in the country to be vice president of government affairs.
Were they aware of your recovery, by the way?
Yes, they were. Yeah.
And supportive, I assume.
They were. It was a small town in Idaho and Boise, and everybody kind of knows everything.
Boise, Idaho. I remember a restaurant there called The Torch.
It's still there.
With finger steaks.
Yes.
Oh, my goodness.
Yeah, absolutely.
But I digress. So continue on. You were in Boise, and then what happened?
They had never had anyone on staff for government affairs as large as it's a $9 billion company. Had operations in 23 states and 18 foreign countries. And they decided to bring somebody on. So I came on, wrote my own job description, and served in that role for 20 years. Headquartered in Boise, but I had a home in Washington, D.C. because that's where the job was. And I was back and forth.
And how did you get to NAATP at that point?
Shortly after that, actually quite a few years after that, some friends who were involved, actually my sponsor at the time, was involved with NAATP, and he asked me to assist the association because they were kind of struggling and wanted to get involved in political game a little bit. And so I did it as a volunteer for, 4 or 5 years.
Wow. What an experience. What is it like in the middle of Washington, D.C., and someone said you're either at the table or you're on the menu?
Right.
Is that true?
It is true.
Well, now, thanks to the work that you're doing, we are at the table.
Well, we hope so. We do our best. And, fortunately, we've got some great members who participate. And when called upon, they call their members of Congress. and that really makes a big difference.
What can the average person in recovery do advocacy-wise to advance our agenda?
Pay attention to the news. There are a number of items that are pending in Congress that are very important to the field and to encouraging recovery. They can always contact NAATP and go to our website. You don't have to be a member to look at the public policy piece of it. Just follow up. Get involved with your local communities and your local members. Don't be afraid to make the phone call and say, this is important to me as a constituent.
And sometimes if an elected official is at a function, introduce yourself.
Absolutely.
And let them know that, you don't have to tell me a whole story, but you can have an elevator pitch to them.
Absolutely.
It's pretty easy.
Yeah.
I remember in Washington, D.C. many, many years ago, Jimmy Carter was running for president. That's how long ago it was. And he was walking in the Capitol Park campaigning. I had been there for the National Council on Alcoholism, which I'd worked for, and I had a tape recorder and a microphone because I was going to another interview. And I looked over and I said, "What's that crowd?" I said, "Oh, that's Jimmy Carter. He's running for president." And so I went right up there, joined the crowd. This is, before another time. The Secret Service was, and it was accessible. And suddenly he turned toward me, and I had the microphone and the recorder. So the one thing I failed to do was come up with a question. And so on the spur of the moment, I said, "Would you care to comment on alcoholism legislation?" And he said, "Well, not knowing what kind of legislation you're talking about, I can't really answer that. But I will tell you that in Georgia, I opened up all of the clinics 24 hours a day." And he went on to talk about what he had done in the state of Georgia. And it was audio gold.
Yeah.
I mean, it was great.
Yeah.
So when you happen to run into an elected official, talk to them, ask them questions,
Absolutely.
tell them, what your concerns are. Now, another thing, people say, well, if I call my congressional office, it's not going to make any difference. I'm just one person. True or false?
Absolutely not true. Yeah, when we send out a public policy update, which is what we call our call to action, we ask members to make those phone calls to their members. And I can't tell you how many staff members from different offices say, that made the difference. We were undecided or we were leaning the other way, and we got calls from constituents, and that made the difference in how we're going to vote.
Does it make a difference, phone call or email?
Any type of communication is great. Email is kind of the standard these days, but phone calls are great.
Yeah. And a friend of mine has said, well, I'm not going to bother and go and visit people in Washington, D.C. I'm never going to see my congressman or my senator. I'm just going to meet a staff person. That's where the action is. Talk about that.
Yeah, absolutely. Washington is run by young, talented, energetic people.
Yes.
And they're there for a reason, because they're extremely bright and talented, and their bosses pay attention to them. They can make a big difference in how they vote.
Yeah. So don't just look to the person who is in elected office, but their staff.
Absolutely.
Their staff.
Yeah.
What are some of the key issues that we're going to be facing in the next year?
Well, we're still trying to get mental health and addiction parity implemented.
It's there, but it's not there.
Well, it was passed in 2008.
Yeah, but best kept secret in town.
We've been struggling since 2008 to get it.
Why?
Well, because insurance companies don't like that law, and they spend millions of dollars fighting it tooth and nail. That's part of the reason. Part of the reason was just happenstance. It was passed and signed by President Bush at the end of his term. And then President Obama was elected, and his priority was the Affordable Care Act. And he delayed implementing parity until he was able to include that in the Affordable Care Act. And as part of the Affordable Care Act, they delegated enforcement to all the states. So instead of going to, the agencies at the federal level, suddenly we had to go to governors, attorneys general, insurance commissioners in all 50 states. And it just turned into a nightmare.
Is there an end to the nightmare in the future?
We hope so. NAATP is a nonpartisan organization, but I do think it's important to recognize people of either party who do the right thing in terms of our issues. President Biden was the first president, in my recollection, in a State of the Union to say that treatment works and recovery is possible.
In fact, for our listeners, I'm going to let you hear his words right now.
I believe in recovery, and I celebrate the 23 million Americans in recovery.
That was legendary, wasn't it, Mark?
It was.
Yeah.
First time, as a matter of fact, as someone in recovery, it actually brought tears to my eyes.
I mean, tears to a lot of eyes around the country.
Yeah.
We have a long way to go.
We do.
But we just keep on fighting.
Yeah. No choice.
Keep on fighting. So again, listen, everybody, go to NAATP and go to the public policy page. You'll find out all this information and how you can help out. You can do it on a state level. You can do it on a local level. You can do it, in your neighborhood. Let people know. Recover out loud. It begins with you. It begins with telling our story and standing up and speaking out and letting people know that, recovery is an American way of life. There's like 25 million people who are in recovery. They're in your neighborhoods. They're in your schools. They're in your churches. They are everywhere. And we need to stand up and put a face and a voice to recovery and get the action in Washington, D.C. to happen quicker. I understand the wheels grind slowly for everything in D.C.
Yeah.
And you run into situations where every 4 years or 8 years, whatever it is, there's a change in administration. And then there's a change in policy. And sometimes it's like going 2 steps forward and 1 step back.
Yeah, but we just have to keep trying.
We have to keep trying. And there are good people. Who are some of the heroes in Congress? Certainly one of them was here at this conference. I had the opportunity to sit down and talk with Congresswoman Dean. Are there other people who will also carry that message?
There are. There are a number of people. We've got friends on both sides of the aisle. Some of them are more active and committed than others. Congresswoman Dean is right at the top of the list.
Oh, she's amazing.
Yeah. Senator Ron Wyden is another friend of ours. He chairs the Senate Finance Committee, is very active and committed to enforcement of parity, for example. Yeah, so we've got a lot of friends.
And I imagine you're pretty open and public about your recovery when you speak with these people.
I am, yeah. In the beginning, it was a little difficult because of the stigma attached.
Yeah.
But what I've learned over the years is that when you're open and honest to people and you tell them, how many years you've been sober, they have an admiration. And the fact that you're, that open with them, it makes a difference. And I've never had anybody criticize me or look down because of that.
I bet you had a lot of people say, well, what do I do about my aunt, my son, my daughter, my friend, my mother, my father, ad nauseum?
Absolutely. Yeah. I bet you over half the members of Congress have somebody in their family who's been affected by this disease.
Yeah. And we need to get them to stand up and get behind us and what we're doing.
Absolutely.
Carry on the good fight, Mark.
Thank you. Appreciate it.
I hope you've enjoyed my conversation with Mark. He's the Director of Public Policy for NAATP. And you can find more about NAATP by going to their website, naatp.org. And by the way, I want to remind our listeners of this podcast, if you would like to tell your story of recovery, regardless of the path that you've chosen, and as long as you've been in continuous recovery for a year or more, drop us an email at recoverycoasttocoast@comcast.net. Coming up next, The Last Word, today featuring historian William White. That's coming up in just 30 seconds.
She has always been your baby, but when your daughter got into drugs and alcohol, she turned into a stranger. What do? Where do you turn? Contact Sundown M Ranch. Sundown's nationally recognized youth treatment program guides young people back to a life free of drugs and alcohol. All treatment is gender-specific and directed by caring certified professionals in a safe environment. You can get your daughter back and get to know her again. Go to www.sundown.org to learn more.
And now, as promised, here is William White, an alcoholism historian, who'll share his thoughts on looking back over the history of the alcoholism treatment and recovery movement.
The roots of addiction counseling actually go very deep into American history. We've traced the beginnings of this sort of wounded healer role to Native American tribes in the 1730s. That also then continues in the early 1800s. We began to see the rise of recovery mutual aid groups, and those really became the impetus for the rise of inebriate homes and inebriate asylums in the beginning of addiction treatment in the United States. As we move from the 19th century into the 20th century, we get a lay therapy movement emerging out of Boston, and that lay therapy model continued through the 20s and 30s. We then move to the birth of Alcoholics Anonymous in 1935 and the rise of individuals within the fellowship of AA, and we saw that both in the outpatient alcoholism clinics that were birthed in the 40s, and we also saw the rise of residential programs such as the Minnesota Model Program. And then as we move through the 50s into the 60s, we get the birth of ex-addict directed therapeutic communities. And we had this role of what was then called the ex-addict counselor working within those therapeutic communities. And as we approached 1970, we began to get a birth of federal involvement in a very significant way. And 10 years later, in 1982, following a turbulent battle over the integration of alcohol and drug treatment counselors, we began to get NAATP officially organized as we know it today. And since that time, NAATP has been the leading professional association of addiction professionals, in particular addiction counselors, through that time period. Currently, the addiction treatment profession constitutes a workforce of about 85,000 full and part-time individuals working in specialized addiction treatment settings. They're also increasingly working in other settings, working in the criminal justice system, working in the child welfare system, working in mental health and psychiatric service settings, particularly with individuals with co-occurring disorders. And we're now beginning to see the movement of those professionals also into delivering services through the primary health care system. We're also seeing an increasingly diverse workforce. For the first time, we now have more women than men working in the field. We have a very large number of people from diverse cultural backgrounds who are now working within the field. They're working in extremely diverse organizational settings and now constitute the primary workforce that treats more than 1.5 million individuals and their families entering addiction treatment every year in the United States.
And before we wrap up this edition of Recovery Coast to Coast, as I mentioned earlier in the podcast, a good friend of Recovery and of the podcast took an amazing photo, which is among the finalists for the Nature Photo of the Year. His name is Nima Sarikhani, and you can see his photo as well as the heartbreaking story behind the photo that he took in the rugged terrain between Norway and the North Pole. The link to see the photo and to vote is in the podcast notes. That wraps up this edition of Recovery Coast to Coast, the national podcast. If you've enjoyed the podcast, and I certainly hope you have, please share it with others via social media or simply telling one other person about it. You can find all of our podcasts at recoverycoasttocoast.org. And if you'd like to get in touch, our email, again, recoverycoasttocoast@comcast.net. And also, please hit the subscribe or follow button. It's free, and you'll be notified the next time we publish a podcast. If you're considering treatment for a friend or a loved one, be sure and visit NAATP.org/AID. That's the Addiction Information Directory. It's a complete list of those treatment programs that adhere to the strict ethical guidelines of NAATP. One of them is Sundown M Ranch, but there's thousands of other good treatment programs around as well. And join us next time for America's Voice for Recovery, Recovery Coast to Coast, the national podcast. And another shout out to our sponsoring organization, Sundown M Ranch, where recovery begins. Sundown.org. I'm Neil Scott reminding you to stay healthy, live in gratitude, and be kind to others. Remember, the bright side of addiction is recovery. Pass it on.